Today we have the pleasure of having with us Eric Latimer, PhD, and the topic today will be Imagine Montreal Without the Homeless. Eric Latimer is a research scientist at the Douglas Research Center and professor, Department of Psychiatry at McGill University in Montreal. A health economist by training, he has carried out research on mental health services and services for homeless people for more than 25 years. Dr. Latimer has carried out multiple studies on evidence-based practices for people with severe mental illness and homeless people, including assertive community treatment, supported employment, housing first, and the strengths model of case management. He was lead researcher for the Montreal site of the $110 million at-home Chez Soi pan-Canadian trial of housing first, an intervention to house and support people with mental illness who have been experiencing homelessness. And he was the lead economist for the national study. He has also led the analysis of surveys of homeless individuals in the province of Quebec. Welcome, Dr. Latimer. Thank you for joining us today. And as they say, the screen is yours.
Okay. Well, thank you very much, everyone. Thank you for the invitation. I want to mention that kind of the Rotary Club as a special place in my heart in the following way. My wife, Ruth, grew up one of 8 children on a dairy farm in Pennsylvania. And she had, thanks to the Rotary Club over there, to spend a year in England when she was 18 years old. She lived with 5 different families, and that really opened her eyes to kind of the wider world, which growing up on a dairy farm in the Midwest, on the edge of Midwestern US, she really did not see, and that led her to do more traveling and ultimately to us meeting and getting married. So so the Rotary Club does a lot of good. I know some of the people here. Glad I was surprised to learn that, kind of a little bit surprised that Sam Watts was here, and Harut, and of course I know Glenn, who was the one who invited me. So good to be here. Thank you for the invitation. So I hope I'm going to share my screen now, and I hope what I'm going to say is not going to be too redundant to what you already know, but there will be some bits, I'm sure, that draw on the economic findings from the at-home Chez Soi study that will be new, and I hope the overall angle I'll take will be of some interest to you. So first of all, you've probably heard of point-in-time counts of people experiencing homelessness. The last complete Canada-wide count was in 2018, and it counted a total of 32,000 people, basically, who were in a situation of homelessness on a given night. So 65% in emergency and domestic violence shelters, 14% in non-sheltered locations. Out of that number, just for your information, the number from Quebec was 5,789. And in Montreal, it was 3,149. So, but what does that mean to be homeless? Of course, we're all familiar with the concepts of people sleeping in outdoor locations. So there were 4,481 in Canada counted in that situation, of whom I think the number was 815 were in Quebec, 678 in Montreal. A large number in homeless shelters. This is a picture of La Maison du Père on René Lévesque. An unknown additional number who sleep in outside locations. We couldn't count everyone. And then there are people in transitional housing. We had almost 7,000 of those. And then people who do couch surfing and people who live in rooming houses. This is what we in Quebec call hidden homelessness. And we really don't know how many of those there are. They're really difficult to count. The other interesting thing to know is that people experiencing homelessness do not statically live in one type of place all the time. They move around from one type of place to another. A person can be in a shelter for a while, in a street another while. They can be also couch surfing for another while. So it's a dynamic model. So that leads us to think that really we can think of homelessness in a two-dimensional sense. That along one dimension, we have where people sleep, and in another dimension, we have kind of the dynamics of the situation. We have people who are always homeless. They're just chronically homeless. There are some people who go in and out of homelessness, and it can be in and out, as I said, of different types of homeless situations. And then there are people who will just experience homelessness once in their lives. Perhaps some of you have seen the film The Pursuit of Happiness, starring Will Smith. If you've seen that film, you may remember that the character, whose name I forget, played by Will Smith, experiences homelessness for a brief time in Los Angeles before ending up becoming very wealthy. Now, what causes homelessness? Well, I think in a general imagination, we're mostly aware of individual factors. People have problems with substance abuse, for example, or mental illness. And those certainly play a role. If we take the classification by Stephen Gates and Aaron Day in a report that you can find online, not only individual factors, but also structural factors and systems failures play a role. And among the structural factors, the lack of affordable housing is really key. And I think many of you have read in the media about how Canada is actually among the G7 countries, the one that has the fewest number of housing units per 1,000 inhabitants. The US is close, but we're actually even a little bit worse than the US. And with our high rate of immigration, coupled with kind of just a too slow rate of building housing in general, kind of the situation is not going better. And we are seeing rents and housing prices, as you well know, going up more and more. The literature is really very clear that rises in rents are a major driver of homelessness. So, so this is not something that's easy to address. In terms of systems failures, we have a lot of failed transitions and silos and gaps. People leaving the youth protection system and not being accompanied into housing, people leaving prisons, people leaving hospitals. And then, of course, the various individual and relational factors that we're aware of. For example, people whose family, as teenagers, their families discover that they have a homosexual orientation and their families reject them. They can end up being on the street. So why should we care about this? Well, the truth is most homeless people do not want to be homeless. It's a terrible way to live. And among the many problems associated with being homeless, I just want to quickly highlight the higher mortality experienced by people who are homeless. We see here kind of an article published in The Lancet in 2018. The Lancet is a very prestigious medical journal. And we see here rates of mortality that are in the order of 6 times greater for people who are homeless than the general population. And among people experiencing homelessness, I want to highlight in particular people who sleep in outdoor locations. You'll remember that that's one of the types of places that people can be. In the Montreal 2018 count, we found that people who spend the night in outdoor locations formed a fairly distinct subgroup. 90% were male compared to 72% in other types of places. And a greater proportion of them, half, had had their first episode of homelessness more than 10 years ago. So basically what seems to be happening is there is a system out there to help people who first become homeless exit homelessness. It sometimes works. Actually, the data suggests that it tends to work better for women than for men. But some men do fall through the cracks. And the further down they fall into the cracks, the more they tend to just end up being on the street, and then they can get thoroughly stuck there until they die, basically. And they will die at a younger age, by 15 to 20 years than the general population. And a greater proportion of those who were found to be homeless in the street had been homeless for all of the previous year. You can see that's 66% versus 43%. A greater proportion have had at least one contact with the criminal justice system. And you might ask, well, why don't they use the shelter system if it's so bad to be on the street? So we asked them, actually, why didn't you use a shelter in the past year? For the 43% who said they had not. 34% had the perception that there were bed bugs and other insects. 12% mentioned fear for their own safety, 12% because of all the rules, 10% because of the smells, the noises, the lack of privacy. So you can see it's a lot of the very same sorts of reasons why you and I would probably not especially want to sleep in a homeless shelter. They're human beings just like we are. A study conducted in Boston that came out almost 5 years ago now reported that mortality among those who slept outside was 10 times greater than in the general Massachusetts population, and 3 times greater, and among those in, it was, those who were unsheltered had a mortality rate almost 3 times greater than those who were homeless but in shelters. So it's particularly bad to find yourself in street homelessness. And we'll get back to that. Now, what can we do about homelessness? I think you've already heard that there's been a shift going on in thinking about homelessness, that we've been moving away from thinking of homelessness as a problem, an ineluctable, inevitable byproduct of living in a modern society, to a problem that can be ended if we set our minds to it. I really won't be talking much about that, but Finland, a country with a population similar to Quebec's, a wealth level similar to Quebec's, has nearly eliminated homelessness at this point. There's one shelter with 50 beds left in Helsinki. It's difficult to find anybody sleeping outside. Most of the remaining homelessness is of the couch surfing type. So it can be done. And in Montreal, we have one network called the Réseau d'aide aux personnes seules et itinérantes de Montréal that is still in an old paradigm of we're trying to manage homelessness, and another network, newer network, the movement to end homelessness in Montreal. That's more in a paradigm we need to end homelessness, and Sam Watts, who's here, has been a key player in that network, in that second network. So from a policy point of view, homelessness can be thought of in terms of inflows, stocks, and outflows. So it's like people are becoming homeless all the time. People exit homelessness, sometimes because thankfully, they find permanent housing, at least for a while. But if the rate of inflow is too high, the stock, just like water in a bathtub, just keeps increasing. And that's the current situation, actually. So how do we help people exit homelessness? A number of approaches have been tested: rapid rehousing, critical time intervention, housing first, and if housing first doesn't quite work, some form of supervised housing. So I want to talk a bit about housing first. I'm just curious, show of hands, for those of you whose pictures I can see, how many of you have heard of housing first? Okay, surprisingly few. So it's worthwhile saying a little bit about it. Well, the predominant approach to dealing with homelessness has been what's called the continuum of care model. We start with outreach. People go to a shelter. If they behave well in a shelter, they'll be offered a spot in transitional housing, and some may end up in permanent housing. And they face generally poorly integrated community care. There have been some interesting initiatives in Montreal, such as something called the PRISM that Sam Watts again knows a lot about. He has one at Welcome Home Mission that go in the direction of integrating healthcare and shelter care. So that's a step in the right direction. But basically, that's kind of been the dominant system. Housing First basically says, let's directly help a person find permanent housing and give them supports. You don't just take somebody who's been on the street for the past 7 years, give them the keys to an apartment and a monthly check and say, great, now you have an apartment, good luck. It's generally not going to work. They need supports, ongoing supports. So Sam Tsemberis, who's originally a Montrealer, but moved to New York City to do a doctorate in psychology, married a local and stayed there, developed the Housing First model in a program that was called Pathways to Housing. So it involves like immediate access to housing. We don't require you to be sober or to have your mental illness issues under control. We view housing as not only as a fundamental right, and from a pragmatic point of view, as something you need to have before you can move on to address other issues in your life. Usually subsidized, scattered site, private market apartments, not congregate housing, which is, this is for many people, this bit is counterintuitive. People think, oh, we'll just build a building and we'll put homeless people into it. But you're then just ghettoizing that group of people. That's not what people prefer. People prefer to be in an ordinary apartment where they can live a normal life. And that's almost universal. So housing and support functions are managed separately, but they work together for the client. So again, if you're drinking, that's okay. The clinical people will deal with that. You can keep your apartment. We help clients pursue their own goals, which can mean improvement in management of health conditions, reconnection with children that the courts have cut you off from, getting a job, a great variety of possible goals. Harm reduction, collaborative approach in dealing with substance abuse, and we're proactive in seeking to help engage clients who want to avoid help. So in the At Home Chez Soi project tested this in 5 cities across Canada, including Montreal. This is what we found on average across all the sites as the percentage of nights that were spent in permanent housing compared to temporary housing for the control group versus the experimental group. We had high need participants who tended to have more severe mental illness and had a more intensive and costly intervention, as we'll see, and moderate need participants. You can see that within 3 months, we had much higher percentages of time spent housed in the experimental group that got Housing First, where we found 70 landlords across Montreal that were willing to house 280 individuals that we enrolled in the experimental arm of the study. On the other hand, shelter use dropped and time in the street dropped for the experimental group. We found that some were not able to function successfully in an independent apartment. In particular, there were women who were victims of predatory males who really needed more protection than an ordinary apartment could provide. We had some people who had other kinds of disabilities that made it not possible, but the idea here is this should be the default goal, and clinicians are not very good at predicting who is going to be able to be successful in this model. We also did qualitative research, and we found that overall, the life trajectories of people in a housing first group were more likely to be positive than in a control group, and less likely to be negative than in a control group. Now, a bit on the cost side. Perhaps some of you came across an article that Malcolm Gladwell, whom you've probably heard about, maybe read some of his books, wrote in a New Yorker a bit more than 15 years ago, in which he talked about someone called $1 Million Murray, that he called $1 Million Murray. Murray was a man who lived in Reno, Nevada, who over the course of 10 years had cost $1 million in ER visits, ambulance transports, detox, hospitalizations, prison stays, and so on. And there's a general assumption in the media that every homeless person is like $1 Million Murray. They cost the system a fortune, so of course, housing them, if we do it, is going to save money. Well, what we found was it wasn't that simple, that actually some people in our sample, they have here a negative cost. That means they actually started working and they earn more money than the services that they cost. There was very few like that, but it happened. At the other extreme, we had a few individuals who cost around $340,000, $350,000 a year, hundreds of ambulance transports per year, like really intensive use of services. $1 Million Murray, if you convert the currency into Canadian dollars in 2016 dollars, which is when I did this, you get about here, but most people are not quite that expensive. This is what it looks like city by city, the cost of services. Medications are excluded. I have to acknowledge that we just weren't able to get those data. But you see an average annual cost of about $56,000 for people in Montreal. You can see that we've included here social assistance, net of any income earned. We also have quite a bit of health and social care. You can see the cost of shelters, which is greater in Toronto than in other cities. You can also see the cost of police, which is considerably higher in Toronto than in other cities as well. And but we're like almost like Vancouver in terms of the amount of psychiatric hospitalizations in our sample. So as was mentioned in that introduction, I was responsible for the economic evaluations, which were published relatively recently. So basically, this is what we found, that we had our housing first group, our treatment as usual group, the high-need group, that was, remember, that was a group that had more psychosis, more functioning difficulties, that subgroup cost $70,000 to $80,000 a year before the study. Both groups experienced a reduction in costs once the study started. They were just chosen at a time when they were costing quite a bit. That's what made them enter this study. So they naturally tended to cost less after that. But except for the cost of the intervention, which is here, you can see that the reduction was greater for the housing first group than it was for the control group. And even if we take into account the cost of the intervention, which is about $20,000 per year, the net annual cost was only about $6,000. So we didn't save money, but it didn't cost very much, taking into account all the cost savings. Similar sort of picture for people who were getting the lower intensity in what's called intensive case management intervention. A greater reduction, again, about half of the intervention costs were offset by other savings. And this is an intervention that costs less to begin with. No psychiatrist, somewhat less intensive. So, so basically, the lesson with regards to housing first is it is generally viewed as the predominant tool for helping people who are currently homeless to exit homelessness permanently. It exists in Montreal. Fortunately, there are hundreds of places in programs like that. The largest is partly run by Sam Watts Projet Logement Montréal, PLM. There's another significant one in an organization called Diogène. There's a few smaller ones, including in an organization I'm involved with, the Open Door. That one is specifically for Inuit. The provincial government has latched on to this. There is money in the latest action plan for about 1,600 additional places of this type. Well, they say there's money for 1,600 places. If you actually do the math, it's the rent supplements are actually way underfunded. But that's not enough for the need, actually. We're not going to solve the problem with current funding levels. We need to do more, and I'll get back to that. Now, the other thing we need to think about is prevention. And kind of coming back to this document I referred to at the very beginning, there's an opportunity to do better on the prevention side. We can do structural prevention. I would say here, kind of the really big piece is we need to sort of keep up the pressure to increase the amount of housing. It's unfortunately an expensive thing to do, but kind of if we're going to avoid homelessness, we have to deal with the housing piece. We don't have to spend as much to deal with systems problems, kind of poor transitions from youth protection hospitals, prisons. Early intervention for people who are at imminent risk of losing housing, such as it's a bit related to systems prevention. Or identify, and some of the shelters in Montreal have been moving in that direction. Somebody becomes homeless, you meet with them right away, help them to get out of it before they have any opportunity to become chronically homeless. Then there's eviction prevention. And finally, help people who were homeless but have been rehoused. That's mostly just maintaining support from Housing First programs. So we have to consider also when we think about prevention that there are many different subgroups, and each requires a somewhat individualized approach. We have to think about how do we deal with people coming out of the youth protection system? How do we deal with victims of domestic violence? What about the influx of Inuit and First Nations? Some of you may have seen the Ombudsman report last week that talked about kind of the growing discomfort that neighbors of the Open Door in the Milton Park area are finding at having so many Inuit hanging out during the day and at night. It's a challenge to deal with. Various people with low incomes, with addictions, who become homeless. So there's not really one spigot bringing homeless people into the system. There are several, and a comprehensive approach to preventing homelessness needs to address all of these points individually. There is currently something called the Quebec Homelessness Prevention Policy Collaborative, which is co-led by James Hughes, the director of Old Brewery Mission, and myself as a faculty member at the Institute for Health and Social Policy at McGill. That is trying to think about exactly that. How can we address homelessness for different subgroups, including women experiencing domestic violence, people leaving the correction system, refugees, and a few other groups. I have two more slides and I'll be done. I wonder how many of people here have ever heard of donut economics? No? It actually has nothing to do with the donut that you eat, except the drawing and the visual similarity. Donut economics is the brainchild, if I can put it that way, of a British economist called Kate Raworth, who wrote a book that has that title, which is a very good book. You can also get it as an audio book, which is how I went through it with Kate Raworth itself reading it. I find it a very incisive analysis of the ways that standard economics has gone awry, and how we really need to be thinking, and she provides a lot of examples of some of this thinking that's going on in various places about how we need to find the space between providing for the needs of everywhere, like a just allocation of resources for everybody, without overtaxing our planetary environment. That's like a huge challenge. We want to be in this kind of safe and just space. And if we think about the issue of homelessness, we have a situation here where many of us really earn way more money than we need, and I include myself in that category. We are honestly, I think, not taxed enough. I guess I'm revealing my colors here. A far greater share of our society's resources could be addressed to dealing some crying issues, like the fact that we have these thousands of people who don't have a place to live. It doesn't have to be that way. Finland has shown it doesn't have to be that way. Norway is on the way to making the same demonstration. So we could say Norway is not a fair example because they have so much oil money. But Finland is a more comparable example in terms of wealth level. So practical conclusions, is I'll end with this. There are programs that seek to actually end homelessness. There are programs like that here in Montreal. Projet Logement Montréal is managed by Welcome Home Mission, by Aubry Mission, La Maison du Père, L'Accueil Bonneau. Diogène has a very effective program with a capacity, I think, of around 150. The Open Door has some as well, though it actually also does activities that I would classify as maintaining homelessness with its day center. So ending homelessness is feasible. We should not allow ourselves, in my view, to think of homelessness as something that can't be avoided. We should be more activist about it. I think in many ways it's like climate change. There are individual things we can do. There's a bit of a difference in that climate change. We can actually make changes to our personal lifestyle that will make a small but real impact. We can actually reduce CO2 emissions ourselves. But it's, and we can give to environmental groups. We can also give to groups that are working to get people out of homelessness into permanent housing. But I think in both cases, our individual actions are not going to be enough. There has to be political pressure. So this is kind of an invitation to everybody to become activists, activists about homelessness. And if you want to be activists about climate change, I think that's a good idea too. So I'll conclude here. Here's my email, and thank you for your attention. Sorry if I ran a little bit over.
Not at all. This was fascinating, Dr. Latimer. Are you going to stop sharing screen?
Oh, yes.
Okay, so we will move into the question portion of our meeting. I'm sure there are going to be questions. Does anyone have a question? No questions.
Can I ask a question? It's Glenn here. I'm just curious, do you have even a rough order of magnitude of the hidden homeless? I know you said there's no specific, you can't really count that as a question mark, but I'm just wondering, based on your knowledge, how big a problem quantitatively do you think that is?
Yeah, it's really hard to know. There have been attempts to estimate it by doing phone surveys, but the response rate is so low, it's in the order of 10%, that the numbers are really not very reliable. I think people generally think that there are more hidden homeless than there are, in the sense that I've described, like people doing couch surfing and people in rooming houses. People in rooming houses, in principle, we could count. I just don't think anybody's done it. The couch surfers are harder to count. I mean, I guess if I had to guess, I would guess it's probably like something like 5 times the number that we're able to count. But that's extremely rough. We know when we do population surveys and we ask people, have you ever experienced what amounts to hidden homeless versus have you ever experienced like real homelessness, been on the street or in shelters, we get a significantly higher percentage for, it's a percentage that's in the order of, I think, I forget, 5 to 10 times in that order of magnitude of greater who've experienced it at some point in their lives than in a shelter or in the street.
Thanks.
Thank you. Any other questions?
Yes, Susan, I did.
Please, Nick, go ahead.
I just wanted to thank you for your presentation. It was very informative, and obviously something that, you know, is discussed in a lot of environments here in Montreal, and especially considering our climate in the winter and the seriousness it presents for the population in general.
Yes.
One of the things that I wanted to ask about was, you know, obviously you're talking about a lot of different variables, and a lot of different organizations and institutions. And I guess my biggest question, and I'm sure you don't have the exact answer, but you must have thought about it, is the level of coordination and collaboration that's necessary, you know, not only in terms of methodology, in terms of agreement on how to approach a situation like homelessness, but also then the practical realities of trying to make change that has impact for individuals and families. And so I don't know if you could maybe talk a little bit about your thoughts on that need for coordination, or how best to approach that coordination that's necessary so that there can be genuine impact.
Thank you, Nicholas. I think that's a great question. And yes, absolutely, there is not enough coordination. We have many individual community nonprofit organizations delivering services with kind of just applying for funding year after year to continue doing more or less what they've been doing without like a coordinated overall plan to say, we are going to end homelessness. The government wants to not generate too much pushback from all these organizations. There's also coordination problems between different government ministries. I'll give you one concrete example. The Ministry of, how would we say it in English? Municipal Affairs and Housing is the one that issues most of the rent supplements. The rent supplements are not designed to be very useful for programs like Projet Logement Montréal that, again, Sam Watts is helping to manage. We need flexible rent supplements that people can take with them if a particular placement in an apartment is not working out. They need to move somewhere else. Right now, the rent supplements are tied to a particular apartment. And if you lose it, and for some of those rent supplements, if you lose it, well, that's it, you're barred. You're not going to get another one ever, practically. So it's not thought in a coherent way with the needs of addressing homelessness. I mean, personally, if I had that kind of power, I would suggest having this kind of thing you see sometimes in the US, a kind of czar, some group with an identifiable individual who has broad powers, who can just focus on we are going to end homelessness. So that's going to mean we're going to build a lot of housing. We're going to gradually stop delivering certain kinds of services, shift the money to other kinds of services, and we're going to, for example, we'll look at people leaving the youth protection system. It's kind of insane what's going on right now. A young person with enormous psychological handicaps, complex trauma, has been shuttled from family to family for years. We're telling them at 18, for the most part, okay, good luck. There's a programme Qualification Jeunesse, which will accompany them for another year, maybe 2 years. But that's not enough. We know, many of us, many of you are my age or perhaps a bit older, and you have adult children, and you know that they're not ready at 18 to make it on their own. They need support sometimes into their 30s. So there's a lot of things that we do that are just do not follow a logic designed to end homelessness. So yeah, there's a huge need for more coordination.
I have a question.
Yes. Yes, please go ahead.
Cities throughout the world have this same problem. Singapore, I believe, has eliminated homeless people situation completely, and Helsinki, a city that I have visited 20 times,
Wow.
has largely eliminated homeless people situation. Are there any international conferences that we can share this information? How to accept this challenge?
International conferences? Yeah, sure. There's an International Housing First conference that the last iteration of which took place virtually last fall, where there were presentations from many countries talking about various refinements to Housing First. Even a country like France is now starting to think about how can we broaden it to not just people with mental illness, but other groups of homeless people. How can we, I saw a presentation from Lisbon about how do we adapt it for people who have serious substance abuse issues. Now, but I'm not sure that completely answers your question.
Yeah, thank you.
Okay.
Okay.
So we have 3 questions queued up. We will go to Jim Fairs first, and then I have a question from John Donovan and then Sam Watts. So Jim, do you want to ask a question?
Thank you, Susan. It seems to me like so many other problems that we have in society that ultimately it comes down to 2 things. There's a question of money and there's the question of political will.
Yeah, which are interrelated.
If you've got those 2 things, you're fine.
Yes.
Now, and I get the impression that in terms of money, it's not a huge amount of money necessary to solve this problem, but I get the impression that for governments, it's not really a vote-getting scheme for them to get involved.
Well, that's a good question. I mean, if we abstract from the high cost of housing, if we were in a situation where we figured we could just house everybody who's currently homeless, give them rent supplements, it's true, it wouldn't cost very much. I'm currently involved in an exercise where we're estimating that to house another 1,500 people would cost somewhere in the neighborhood of 60 million over a period of 6 years. It's not an exorbitant amount of money. I think what makes the problem more daunting is that we have to consider as well what is happening to housing prices. It's a little bit like, gee, I'm trying to think of an analogy. Well, if I come back to the bathtub analogy, it's like you've got one of the taps pouring water into your bathtub that's open very wide. As long as you if you don't shut that tap, you're not going to solve the problem. Rents are going up, they are headed upwards. And that just means that more and more people are just not able to afford to be housed. So, so we got to deal with that. And that bit is expensive. It's not impossible to address for. Well, Sam Watts should answer that question. Yes, it has been used as a kind of emergency shelter for kind of overflow people. Is it, does that type of program work? It works as providing like emergency shelter. It's not a permanent solution. But I want to, I'm just going to invite Sam to make a few comments because he knows more about that than I do.
Yeah, thanks, Eric. It got started at the time when we were in a bit of a situation where we needed something in a hurry that could be made available. The facility itself is in really rough shape, but nobody's really using it right now. I could give you a long list of problems that would include asbestos, lack of running water, absence of showers, electricity that doesn't work, Wi-Fi problems, building falling apart, windows. I mean, it's a long list of things. But more important, the goal that we have, as Eric quite coherently outlined, is not to put people in temporary shelters. If I had my way, I would reduce the number of emergency beds available in Montreal. And I'm constantly on the media because they're after me all the time to say, how many beds do we have? How many beds do we have? I said, the question you should be asking is, how many people have you housed in the last week? That's the real question. Yeah. And so it's not about emergency shelter any more than we want to increase the capacity of our emergency rooms in hospitals. We want to reduce the time people spend in an emergency room in the hospital. Same is true for an emergency welcome center for people experiencing homelessness. So the answer is not facilities like the old Royal Vic. And for reasons of the construction of the place, it's even less of an answer.
Yes, absolutely. Absolutely.
Thank you, Sam. Thank you.
Sam. Yeah.
So Martin, I will read your question as is, but please feel free to unmute and pipe in if you want to. The federal government recently issued a new plan to improve housing across Canada in budget 2022. Do you think Ottawa's new plan does anything to improve things for the homeless? And this question is from the Westbound Independent.
Yes, it does help to some extent because some of the Reaching Home money is being used to continue to fund housing first type programs. So in that sense, yes, there was also money to develop additional social housing that was developed very quickly across the country. That was a step in the right direction too. Clearly, we need more money, I would say, from the federal government and the provincial governments to fund additional housing. The funding for the services that to accompany people once they're housed, that mostly is under provincial jurisdiction. There's been some money for that in the provincial, the federal funding, but mostly this is an area of provincial jurisdiction. And if we're really going to solve the problem, it's going to have to come from the province. And in fact, I'll just mention Alberta has been ahead of the curve in this area for a long time. In 2008, at the impetus of people in the oil industry, Imperial Oil, Suncor, Alberta decided to really try to end homelessness. They poured a lot of money into it. They built a lot of housing, provided a lot of services, set up coordinating agencies, the Calgary Homeless Foundation, Homeward Bound in Edmonton. That has had some effectiveness. It hasn't been enough to end homelessness, but the numbers have gone down and they're certainly well below what they would be today had it not been for those initiatives. So, so that's a good example as well, but that came from the level of Alberta, not the federal government.
Thank you, Eric. Martin, does that answer your question?
Yes, thank you.
Super. All right, we're going to end with Harut's question. Harut, please go ahead.
Yeah, I'm not terribly politically savvy, but I remember the national housing strategy from Justin Trudeau a few years ago, just prior to the COVID pandemic. There was about a 10-year plan for $70 billion that would include all three levels of the governments, so municipal, federal, provincial. And that, I guess, was derailed by the pandemic. But my question is, I'm a little bit doubtful in that if I'm a politician and I have a 4-year term, why in heaven's name would I propose something that would last 10 years, knowing that I might be ousted in the next term? And would the next government want to take on that previous government's burden? Because generally speaking, I think they're a little bit, short-sighted. What's unfortunately a human nature is to think only of myself and my selfish interests immediately. I think it might take something other than just political will. So my question basically is, how do I become an activist? How do I participate in applying pressure somewhere that it could actually manifest?
Yeah. This is not a realm where we see quite the same degree of organized activism as climate change. I mean, there is in Montreal the movement to end homelessness in Montreal. I think joining that organization as an organization is a small step in that direction, helping to fund it. They are definitely a voice that the government is not ignoring at present. It's kind of a counterweight to the RAPSIM, which I see more as a defender of the status quo. Beyond that, there's always writing your representatives, that tried old strategy, writing op-ed pieces. Beyond that, I mean, there's the annual event, La Nuit des Sans-Abri, which takes place at the end of October, which one can participate in. How much influence that has, I'm really not sure. Those are the main kinds of things that I can think at present, short of really trying to start being a real leader and trying to rally a lot of the population around a movement, becoming like a sort of Greta Thunberg of homelessness in Quebec or in Montreal. But that's not that's not everybody's calling or cup of tea.
Eric, thank you so much. If we don't start to end it here, we're going to have you here all afternoon, because this is absolutely fascinating and your presentation is trenchant and interesting. So I'm not going to go on and on. I am going to ask Sam Watts if he would kindly thank you even more appropriately.
Well, thank you.
Hey, Eric, it's a pleasure for me to, first of all, connect with you today. I haven't talked to you in a little while.
Yes.
But a lot of people may not recognize the kind of passion that Eric has for this issue. And, sometimes leaders in the sector like myself will get a fair amount of attention, but we stand on the shoulders of giants. And Eric, you're one of those giants.
Wow.
You may not know this, Eric, but the federal minister of housing just appointed me to sit on the National Housing Council, which Harut, to your question, that is the body that is required to advise the minister on housing policy, and he by law has to listen to us. So unless I'm a jerk, he's going to listen, and we'll see where that goes. So
Very
to some
good.
extent,
Congratulations.
I've been given a voice in that area, and I suspect the minister will announce it shortly. But I want to thank you, Eric, for your leadership, the academic prowess that you bring to this. And I have shamelessly borrowed on a lot of your findings in order to make points that I need to make with people who need to hear them. And so I'm very grateful for that. And I think all of us here at Rotary are very grateful for your leadership in this area and for the fact that I think we're all beginning to understand that homelessness is not something that we need to simply manage or live with or expect in a large city or even in a smaller city, but it's something that we actually can address, not just for the dignity of the people involved, as important as that is, but for the benefit of our society. People who are housed and who are living in security with adequate shelter and food are productive members of society. And so they return enormously against the cost of putting them there. We all know that. So thank you, Eric, for this presentation. Thank you for being available. And hey, we're going to be continuing to work on the next point in time count. You and I are both on that committee. So
Yes.
Here goes. It's going to be October of this year, we hope. So
Yes, absolutely. Well, thank you so much, Sam. And congratulations to you for that appointment, which I think reflects your own significant leadership in this area. Thank you, everyone. Thank you, everyone, for your interest. And maybe we'll connect at some other point. All the
Thank you
best.
very kindly, Eric. And please, if you need to leave, we will understand.
Yes,